All right. Well, there we go. I see this now. Well, I am really excited for us to go into the last session of our time. We finished our educational meeting part and our continuing medical education pieces. But we are now going to enter our business meeting that is going to be led by Dr. Avery, and we'll have a very brief moment in there at the end with Dr. Rogers and Dr. Wheeler, who will be available for any questions around our foundation. And I'm just going to turn it over to Dr. Avery and just tell everybody thank you so much for joining us, and we will get going now.
Well, thank you, Anna. I hope that everybody has enjoyed this wonderful, informative conference so far. And this is our opportunity for those who are interested. We'll probably lose some people, but for us to share, what we are doing as a chapter and nationally, and just go through some benefits of AAP membership. All right, so basically, I'll just be running through the President's report, including some of the things that we've been doing over the last year. And then we will present some chapter awards, as Anna has mentioned before, and then spotlight some national AAP engagement, which we'll just discuss the summer leadership program and also the upcoming AAP president election. And then we'll wrap up with how to get involved in a quick foundation update. We always like to remind people of the mission of the AAP. And this is our Arkansas chapter of the American Academy of Pediatrics mission, is to attain optimal physical, mental, and social health and well-being for all children in Arkansas through advocacy, service, and professional support of our members. I'd like to go over our chapter board of directors for the year 2021 through 2023. The year officially begins in July. So these are all newly elected board members, elected or selected. Myself, Susan Averett, as president, Michelle Moss as vice president. We've got Gwen White as treasurer, Sarah Bone as our secretary, Gary Wheeler as our past president. Then we have board members Rick Barr, Akila Jefferson, Natalie Burr, Whitney Alexander, Douglas Seglum, and Carrie Reed, who is our resident representative, as well as our staff members, which are Anna Strong, our executive director, and Katie Clark, our project coordinator, which you have seen and met both of them. And just a word of mention about our board of directors is that we are proud that our chapter board of directors is representative of a variety and diversity of pediatricians who have different roles including private practice, academics, and are from various places around our state. One thing that we have been very proud about, and I think that we can attribute to multi-factors, but especially to Anna and Gary's leadership over these last 2 years, especially leading us through these difficult times with COVID and all of the change that, just as Dr. Romero said, I'll give you a report next week and it'll all be different. That's kind of how our last year and a half have been. But during that time, we've seen a significant upswing in our membership, and people have been taking advantage of and coming together as members. And so we've seen about a 20% increase in membership over the last year, and our current membership stands at 477 people. Some just administrative and financial components to our discussion. We have a very transparent executive director who likes to make sure that people understand and are aware of our operational budget and the finances. And so we are sharing that we currently have about $340,000 in our operational budget. About 15% of that comes from membership dues and conference revenue, and about 85% comes from grants and contracts. Our account balance we have about a comparable amount in our checking account and in our reserves. Over the last year, we have or a couple of years, we've had some changes to improve the benefits for our staff, to include a health insurance stipend, an IRA with company match, and some paid leave. So now we want to talk a little bit about our advocacy efforts as the AAP, and we have come together. Anna and Gary put together an Arkansas Blueprint for Children that was put together based on several components of information that they gathered. They utilized the National AAP Blueprint, as well as participated in site visits with multiple sites, pediatric sites around the state. They discussed practice issues and child health issues, and then they really took into account resident engagement and what the residents saw as needs for themselves going in and for their patients as well. So these are some of the facts that they took into account when they put together this blueprint. We have had multiple areas of significant advocacy through our Arkansas chapter of the AAP. And so just kind of highlighting several areas of focus, you can see that we have had a COVID-19 response that has been impactful and significant, that helped advocate for pediatricians regarding personal protective equipment and testing for clinics and communities, guidance for the schools and childcare facilities, and including gaining access for pediatricians to help with the delivery of the new vaccines. We've had addressed and helped respond to the public health emergencies, such as the childhood immunization gaps. We've also been part of advocacy for financial relief to providers through government programs, and have provided multiple opportunities for discussion and learning about COVID-19 with experts in our field, just like we're doing today. In terms of sustainable pediatric care and practice, we have done a lot of promotion of working with the Medicaid services to increase fee-for-service rates and help reducing the parity of Medicaid in our Kids First patients. We have worked towards getting enhanced delivery and payment for the vaccine program, and also helping increase our funds in the medical home. We've gotten new funding for medical aid services, and just continuing to do other things to help support medical home, as well as physician wellness and burnout mitigation, so that our practices can be maintained. We've done a lot of work towards improving developmental and behavioral care of our patients by ensuring that payer coverage for the Bright Futures recommended screenings and services, supporting care models such as Healthy Steps, which is a program that will benefit patients throughout our state, and services including developmental, behavioral, and social needs and resources, and had attempts to remove barriers to integrated behavioral health. And then with regards to social determinants of health, we have worked with our community environmental factors, trying to work towards long-term improvement of child health and families. We have worked towards supporting policies that protect children through advocacy and other avenues, as well as working towards tobacco use prevention. And we have had multiple activities to support economic stability, access to care, and other resources. And we are really currently focusing on policies that reduce systemic racism and positively impact children of color in our state. These are some specifics towards the COVID-19 response of some of the things that I just previously mentioned. We had a lot of interaction with different organizations that resulted in securing up to $8.7 million in CARES Act funds to practices, and working towards efforts for financial reimbursement for practices that took initiative to reduce immunization gaps during the COVID pandemic. We did our chapter webinar series, which engaged pediatricians around the states and helped with education. We were part of advocacy around the safe school environments, both in 2020 and in 2021, by advocating and providing PPE, as well as advocating for delaying school in 2020 and helping with local decision making. And then in more recent times, really working hard to address the need for school-wide mask policies. We've also been a part of providing pediatric vaccine access. And then in July, a group of us, and you can see us pictured here, met with Dr. Bashara Shukair from the White House COVID Task Force, discussing needs and issues related to vaccine uptake of the COVID vaccine for children in the state of Arkansas. In regards to our sustainable pediatric care over the last year, we had success in improving reimbursement for pediatric practices, an 8% increase in E&M codes. We had a 37% vaccine administration increased fees and 62% for flu administration. We advocated for telehealth coverage for pediatric services in our state. We have been able to ensure some funds for, and we are still working on getting some reimbursement for Bright Future recommended screenings. And then we have done some physician wellness efforts, including a few virtual happy hours where we've been able to network and get some pediatricians around the state together virtually. And I don't know if you guys have heard about Healthy Steps, but this is something that we're very excited about, and we've received a huge grant to help institute Healthy Steps throughout the state of Arkansas in certain practices, and then hopefully that will lead to global intake or uptake of this service. It's and I'll speak a little bit more to this later, but it is a program that embeds social work for early childhood in pediatric practices. We participated in the Arkansas Behavioral Health Integrated Network's efforts to improve access to integrated mental health care. And we also have the ACT Early grant and have been able to partner with Angie Scott, Arkansas's ACT Early ambassador, and she's been educating pediatricians in the state about the ways to get patients plugged into services for early intervention. And then addressing specifically some of the social determinants of health, we've had Josh O'Neill, who has been a part of our e-cigarette prevention efforts. And we will probably need to discuss anyone who might have interest in continuing those efforts. And then we've worked through with Arkansas Medicaid expansion and advocated for family-friendly policies and home visiting through Arkansas Home, or AR Home. And then we have spent a lot of time, as Dr. Hutchinson mentioned earlier, supporting our transgender youth through some of the more significant court and anti-transgender laws that they've experienced throughout the last year. Regarding the legislative session in 2021, what we do is we pick some of the areas that seem to have the most impact on child health, and we advocate and spend lots of effort. And Anna is our legislative person that helps us to advocate for or against some of the acts that have been proposed and are on the docket. And this year, we felt very excited about some of the successes that we experienced in these House bills that are mentioned, such as working with the pharmacy groups to help make sure that kids who received vaccines at pharmacies weren't missing out on their opportunity to be seen in their medical home, and that VFC was included in that group. We worked to make sure that pharmacies weren't allowed to prescribe medications to children without physician involvement. We had some testifying in the sunset of the soft drink tax, which we wanted to make sure stayed into effect so that those funds would go into the Medicaid Trust Fund. And then we had success with House Bill 1061, which is the No Patient Left Alone Act, which was to make sure that we were still able to see our adolescents in their healthcare visits and spend time with them without the parents in the room. We did have some limited impact on these, but not necessarily able to fully succeed in the way in which we wanted with the House bill that prohibits the mandated COVID vaccine. And then we did work towards our thoughts on the habitability bills, which were really addressing safe living situations, highlighting the impact on child health. And so we were able to make some impact, but not to the degree to which we were hoping. And there are some bills that came out on the opposite side of what our desired outcome was. And we've already mentioned the transgender bills that all were passed. And we worked really hard and were even able to have some personal meetings with staff from the governor's office. You guys may be aware that the governor did veto these House bills, but then they met again and overturned the veto. But these have been put on, the Act 626 has been put on hold by the courts, and we've been involved in an amicus brief that was presented to the courts, which was part of the change in this and temporary injunction for offsetting that bill at this time. We also were trying to get the 12-month continuous coverage for kids who were on Arkansas so they didn't lose their eligibility. And then Act 1002, which prohibited the use of masks in public spaces, including schools. We have been very engaged this fall in a special session, as well as the amicus brief. Anna likes to say we didn't engage in this one because she was not available and was having a baby. But I don't know that our involvement would have mattered at that time, but I do think our involvement in the fall and the AAP's involvement and helped the courts to decide that at least to override that law so that mask mandates could be optional within school districts. So our chapter is involved in programming and grant engagement, and Anna can rattle these grants off and know every detail of them, but let's suffice it to say that we have several very involved in grants that give us lots of opportunities and resources for the children of Arkansas. The Pritzker Children's Initiative has policies to work towards supporting early childhood education, health, and well-being. And I believe this is where our Healthy Steps grant comes from. Anna, you can jump in if I screw this up. But
sure, the Healthy Steps operations come from different funders and go to different partners in the state. But yes, the Pritzker Children's Initiative allows us to work on the policy part of that.
Yes, that's what I mean by you just rattle that stuff off. It's so impressive to me. I'm not very good at that part of it.
Don't ask me to rattle off any clinical anything. So we'll just, each focus on our work.
We'll trade off on the rattling off aspects of this. But we have these really important grants that we've seen some of the benefits of during these presentations with Delta Dental. We hopefully others have benefited from the Act Early grant with learn the signs and act early. Project First Line, we also benefited from some infectious prevention and control education. And then we have a new grant which addresses food insecurity, screening, and referral. And Anna, do you want to put a plug in for recruiting 3 practices to participate?
Sure. This one hasn't even really started yet. Many thanks to Dr. Ochoa for being our physician lead on this grant, but we are working with some partners at the state level, and we'll hope to engage 3 pediatric practices in piloting a toolkit that the AAP has put together on screening for food insecurity with a two-question screener in a clinical setting, and developing some partnerships to refer those patients who do have a food insecurity need to community partners. So if you are interested in that, shoot me a note, and we'd love to get some great practices involved in that work. There are some stipends available to the practices. So
that's always good to know. All right. Well, with all this hard work that our chapter has put into the last year, the National Academy recognized and noticed this hard work, and we were asked to submit more information to be considered for, and then ultimately selected as the medium chapter category outstanding chapter for 2020. So looking ahead over the next 2 years, we will definitely continue our grant-related engagement. We will continue to advocate for improved screening reimbursement, sustainability for Healthy Steps model in Arkansas long-term. We will look ahead towards the 2023 legislative session. Our national and local chapters have been encouraged to and are really focused on equity, diversity, and inclusion. And so we will be working towards developing more of those policies and having initiatives. We are putting together a committee, and so we also would ask if anyone is interested in becoming part of that work through the Arkansas chapter. Again, please let us know. We have a grant pending to allow us to perform an echo project on the adolescent depression screening tool, and then ongoing chapter webinar series that has been really beneficial to our members. So before we move on from the Arkansas chapter and what we've been doing and what our plans are for the next couple of years, I wanted to see if anyone had any specific questions for me or for Gary or for Anna about what we've done or what our plans are. And Anna, let's see.
And if you also have any ideas of what you would like us to be working on, if there are areas you want us to look for grants to think about, or things like that, just please let us know. I know I mentioned this to the Dr. Stravinsky, who presented one of our breakout sessions. I said, if there's ever anything that we can help apply for that would be a good partnership with your department, let us know. So y'all just keep us in the loop if there are things that you're interested in.
And one thing about the AAP is that there's an area for everything. And if you're interested in an aspect of pediatrics and you don't feel like you know enough or have connections or networking, or if we're not addressing it in the way that you like, there are groups and committees, sections, and councils that cover all of the areas of pediatrics and then some. So if you need help getting engaged in any of those groups, if you'll let us know, we can help you make those connections.
I wanted to put a plug in for the topic area of diversity, and that has been a big focus for the National AAP. One of the guidelines for people that do work in this area is understanding the past. And there's a number of suggestions that have been made. And when we think about Arkansas, you think about not just the traditional issues around racism with the history of racism, slavery, and Black people in America, but also the things that have happened over the years in Arkansas, such as the internment of Japanese during World War II, the extermination of Native peoples in the state. So there's a lot of things that are going on, but one of the purposes of getting a committee together is to explore our own history of racism within pediatrics in our state and make sure that we understand that. So that would be one of the first chores. So people who are interested in history and would like to go get involved in talking to people like Dr. Elders and others who have been some of the leaders in addressing racism issues in the state, please let us know and sign up for that committee.
And I agree that, a personal interest is probably the best criteria for being a part of that committee. So if you have a personal interest, just please let us know. We have yearly awards that are presented to pediatricians to recognize outstanding work of individuals or chapter achievements. We've already mentioned our chapter award. And so now we wanted to mention some awards for individuals. The first award is to recognize Dr. Tony Johnson, and the American Academy of Pediatrics proudly presents a Special Achievement Award for distinguished service and dedicated to the mission and goals of the Academy, for embodying the true spirit of the AAP with his quiet yet powerful, well-respected voice within state-level advocacy and national board service. Yay, thank you, Dr. Johnson. Next, the American Academy of Pediatrics proudly presents a Special Achievement Award to Maya Lopez for distinguished service and dedication to the mission and goals of the Academy, for her years of work to ensure high quality early childhood care and experiences that built a foundation for incredible growth in this area for the chapter in 2020. Yay. Thank you, Dr. Lopez. And we have an award. The American Academy of Pediatrics proudly presents a Special Achievement Award to Jane Sneed for distinguished service and dedication to the mission and goals of the Academy, for her dedication to children who benefit from her persistent, consistent voice within systems change, including children with special needs and foster kids. Thank you. And the American Academy of Pediatrics proudly presents this certificate to Gary Wheeler as in his role as chapter president, District 7, 2019 to 2021 for the Arkansas chapter. So, job well done. We really appreciate these people, and we want to make sure that we recognize the people who we have noticed this year in the past year as working hard and being dedicated to children. We are all under a lot of stress and duress, and it's been tough, but we want to make sure that we take the time to just make a special recognition to these folks.
And can I just break in and just give Dr. Wheeler a special shout out for leading us through the pandemic. I will just say that as a new executive director and someone who had come on board a few months before the pandemic hit us, I could not think of a better partner to help walk through that year and all the ins and outs of what we had to deal with than Dr. Wheeler. And I am incredibly grateful for his mentorship, his guidance, and the immense amount of time he has spent on chapter work during the past 2 years. So thank you, Dr. Wheeler, from both a professional and a personal angle for everything that you've done. So thanks.
Do any of the people on either those who were recognized or other people that might want to say any comments, does anybody have anything that they want to add at this time? It looks like Chad might have his hand up.
I raised my hand. Yeah, sorry. I was trying to get off mute and share video and everything. But anyway, I did want to recognize Dr. Johnson for his tremendous work on the national level and for the local level. 20 years ago, when I headed down this rabbit hole of state AAP work, the person who encouraged me the most was Tony. And, he's done remarkable work. He did great work here on the state level, serving as chapter president, and his work, his mentoring to so many people I think Dr. Bone, I don't know if she's still on here too. We could go on all day long. But, you know, having served on the national AAP, Tony, you're the best. Anyway.
Okay, you're getting, that's so sweet. Tony, do you want to say anything?
Well, I just want to say it's been a huge opportunity over the past 20 years to serve in a number of roles. And but what has been even more exciting than that is to see what's happened with the chapter over these last few years. I mean, I can't, you know, I can't think about, just like Anna said, you know, with, you know, Gary's leadership, Anna's leadership, and then now you, Susan, taking over. I think we've got a lot of bright future ahead for the chapter.
Thank you, Tony. And I do, Anna, think that you're right about Gary. He's done an amazing job. And just to think about where we had no idea where we were going to be in 2020, but to have had Gary with his knowledge and expertise in infectious disease and health department and advocacy background, it just was really so immensely helpful to the pediatricians in the state, because the information that he provided and his timeliness and also calmness, I think just were outstanding forms of leadership that none of us knew we needed, but are so thankful that we had.
I just want to say a couple of things. First of all, thank you to Susan for volunteering. And I'd like to point out and echo what Dr. Beer said yesterday. She's been amazed at the way pediatricians have stepped up around the country on all sorts of issues. And it's been exactly the same thing here. All I've done is ask people to help, and every single person has responded. So any success the chapter has had is because of the contributions of all of you, either in your private practices and your day-to-day activities or the activities you've been engaged in with the academy. So thank you to all those people, whether it's somebody that we've asked to come speak to the legislature, or someone to work as a liaison, or someone to otherwise interface with the AAP. You've all done it. And I'm mostly excited about the engagement of our members right now. I think we're functioning well as a unit because there are so many people that want to address the challenges that we all face. So thank you to this wonderful community of pediatricians that I'm fortunate enough to be part of.
Let me see if are you looking in the chat, make sure does anybody else want to make any comments at this juncture? What I wanted to do at this point is, I don't know if you're like me, but whenever it comes time to vote for the AAP president, a lot of times I don't know the candidates or anything about them. And so I feel like I'm just voting for names or not voting. And so since we decided to meet at this particular time of year, I think this is now a good opportunity for us as members to learn a little bit about the two candidates that are running for president of the AAP. It is currently voting time, so elections are now open for about 10 more days. And so what I wanted to do at this time was to just play the video, the introductory videos of each of these candidates, and then provide you guys with a link to vote and encourage you to vote for our leadership.
Welcome, AAP members. On behalf of the National Nominating Committee, we're pleased to introduce our 2021 AAP President-elect candidates, Dr. Sandy Chung and Dr. Joseph Wright.
I would like to introduce you to your first speaker, pediatrician Dr. Sandy Chung. Dr. Chung has held over 30 state and national leadership positions, including the AAP Virginia chapter president, and serves as medical director of informatics at Children's National Pediatric.
Oh no.
Darn it.
It was going, it's buffering.
Let's see.
As I said, it was working in the chat.
We made it up until 1:07 on the last day without any horrible technical issues.
Do you think that,
We could put this link in the chat and folks can watch it afterwards.
If we, can we try one time to refresh it and see if it'll,
Yeah.
I would like to introduce you to your first speaker, pediatrician Dr. Sandy Chung. Dr. Chung has held over 30 state and national leadership positions, including the AAP Virginia chapter president, and serves as medical director of informatics at Children's National Pediatric Health Network and as CEO of Trusted Doctors, a group of 120 pediatric clinicians in Virginia and Maryland. Her passionate advocacy for child health and the success of pediatricians has delivered major advancements in healthcare equity, mental health, EHR burden reduction, appropriate payment, physician well-being, and optimal child health policies. She has appeared in the Washington Post, Wall Street Journal, and AAP News. Dr. Chung is the proud mother of 4 children. Dr. Chung, I pass the microphone over to you.
Hello, my name is Sandy Chung, and I'm honored to be a candidate for AAP President-elect. As a primary care pediatrician and child health advocate, I believe strongly that every child deserves high-quality, affordable healthcare. The pandemic has revealed new layers of longstanding challenges that must be addressed. The first challenge is equity. Combating systemic racism and inequity is essential to our organization and our nation's health. As a child of immigrants growing up in poverty, I experienced racism firsthand and will work with you to combat it. Together, we will champion the AAP equity agenda, including supporting pediatricians who identify and care for racial trauma and empowering the delivery of culturally and linguistic effective care. The second area to address is mental health. In my practice, we have seen the enormous strain on the emotional well-being of our patients, families, and colleagues. To help with this, I work collaboratively in Virginia, founding a $7.5 million statewide pediatric mental health access program. I'm committed to finding similar creative solutions and building resilience together. The third challenge is lifestyle. Our professional and personal lives are intertwined, and maintaining balance is priority. The AAP must address the burden of button-clicking metrics in our EHRs, strengthening the medical home, including ensuring adequate payment, and supporting the diminishing workforce and uneven distribution of specialists. As a working parent and a pediatrician in practice, I know these challenges, and we will join forces to solve them. The fourth area is our strengthened advocacy. Pro-child policies and regulation based on scientific, evidence-based research are critical for optimal child health outcomes. United, we can be the strongest voice for our youngest and most vulnerable. As a passionate advocate for children, I would be honored to serve all of you as we create a brighter future together. Thank you.
Now I would like to introduce Dr. Joseph Wright. Dr. Wright is Chief Medical Officer and Professor of Health Policy within the University of Maryland Medical System, previously serving as Chair of Pediatrics at Howard University and Senior VP at Children's National Hospital, both in Washington, D.C. He's in the original cohort of pediatric emergency physicians and has broadly contributed over 100 publications to the literature. Recognized with 2 AAP Career Achievement Awards, Dr. Wright chaired the Task Force on Addressing Bias and Discrimination and is a sitting board member. He earned a BA from Wesleyan University, MD from Rutgers University, and MPH from George Washington University. Dr. Wright, I pass the microphone over to you.
Hello, my name is Joseph Wright. As an active volunteer within the American Academy of Pediatrics Committee, Council, and Section Leadership Structure for more than 3 decades. I have borne witness and been a direct contributor to several of the Academy's policy, programmatic, educational, and legislative victories on behalf of children and families. Through multiple appointed leadership roles and numerous invited representations on behalf of the Academy, I have come to understand the tactical importance of professional credibility and strategic partnership in tackling challenges to optimal child health and well-being. Whether through primarily authoring, co-authoring, or facilitating policy statements, working with the AAP Washington office in framing and presenting congressional testimony, or developing recommendations on cross-cutting issues as a function of board commission task force assignments, I have come to fully appreciate the value of collaboration, perseverance, and consensus building. These attributes are essential in the successful execution of advocacy on behalf of children, the professionals who care for them, and the institutions on which we all collectively depend. I also believe in leading from within. As the oldest son of 2 New York City municipal employees who dedicated their life's work to public service, I have grown to respect leadership humility and have worked to incorporate this principle into my own leadership walk. I couldn't be more proud and honored to be an AAP member at this important moment of inflection and reflection for our organization and for our country writ large. I look forward to the opportunity to continue to serve and to lead. Thank you.
Thank you to our excellent candidates. Now, Dr. Schweitzer would like to briefly summarize the 2021 election rules, which are posted in full on the AAP Election Center on aap.org.
In October 2020, the board approved a significant revision to the AAP national and district election rules in the Board Policy and Procedures Manual. NNC and staff will coordinate the availability and opportunities for candidates to engage with members and to promote their candidacy, including on aap.org.
The AAP will provide additional access to members through chapter chats and town halls, etc., to limit email, listserv, and social media communication by candidates. Reforms are meant to promote equal access to candidate information, improve transparency, and to reduce the burden on candidates to reach voters. The new rules also aim to reduce the volume of mass communications sent to the AAP members.
Please visit the AAP Election Center at aap.org/election. Voting will begin August 25th and close on September 8th.
Thank you to our candidates, and please remember to vote.
Way to go, Katie.
It worked. And I think that was very helpful, and hopefully you guys have enjoyed the opportunity to see our candidates, and some of you may not have had that opportunity up to this point. I think we've got 2 really strong candidates. I'm not sure who I'm going to vote for yet, so I have to research that just a little further, but I think you can see what an important role Dr. Beers has played this year. And I think it was really cool that she came and hung out with us for a little bit yesterday because her schedule is crazy. It's either us or Dr. Fauci. She couldn't decide. So, but basically now we have an opportunity to be involved in electing our next leadership. And I think it's important that we know a little bit. So hopefully you guys got something out of that, and then you can remember to vote. Okay. One of the things that we did in our chapter leadership was some of us attended the summer leadership meeting. And so what that is it's an opportunity to bring together chapter leadership and including committees, section, and council leaderships to learn from one another and to discuss what's important now and in the future of the Academy. And it was very special because the members who certain members were allowed to vote on resolutions and changes that will be coming up. We can even submit resolutions if somebody has an area of interest in wanting to get some national attention through the Academy on what's going to be addressed and changed. But I believe Dr. Beers mentioned this yesterday, but at the end of that meeting, we had voted on and made many resolutions, and then had the opportunity to select the top 10, which I guess there was a tie because there's 11 resolutions that would be affecting pediatricians throughout the country. These address things that are very important and critical for the children's well-being and health, as well as advocating for pediatricians to be appreciated and rise to the recognition as health leaders. And the number one resolution voted on by those persons was to work towards basically addressing and overhauling the Medicaid program, so that the funding would be federal, and that would improve the health and make an equity of healthcare for children throughout the United States. So more to come on that. We'll see what ends up being the resolution, but there otherwise are things that will also be on this list. You should see changes and promotions coming out of these with regards to childcare, racism, support for gender equity, promoting the United States as a world leader in child well-being, and other important resolutions. So how can you get involved in our Arkansas chapter of the AAP? We do have several committees. Some of them have already been meeting and functioning. And as I mentioned, there is a new Equity, Diversity, and Inclusion Committee. So what we would like to do is have interested parties let us know, put a committee together, and then some leadership will rise out of that meeting. We are also asking for someone to be our new liaison to the e-cigarette prevention aspect, and that position is now open. There are, as I mentioned, committees, sections, and councils on all areas of pediatric care. So if you have any interest in being involved in the national level, we can get you connected and networked with people who can help get you connected nationally. We can support residents and medical students, and we are proud to have residents and medical students involved directly on our on the AAP state level, and you've been able to see some of that today on this meeting. One way to stay involved and to network is just to continue or start attending our chapter webinars, where you will see and meet and hear questions from and answers from people around the state, both experts and other people in practice just like you that may have the same questions and concerns that you do. Please consider, if you have not already, joining the Arkansas chapter of the AAP. The dues are $175 annually. And if you are a resident medical student or senior member, their membership is complimentary. And now I guess we'll turn it over to have a brief discussion from our ARAAP Foundation with Chad Rogers and Gary Wheeler.
And I don't know which one of y'all wanted to talk on this, or if y'all even really want to. It's just 2 slides and they're pretty self-explanatory.
Sorry, do
Yeah, so either one of y'all, or I can, either way.
Really, so to give a little background of the AARP Foundation, of AAP, not the Retired Persons Foundation, which I guess I'm not part of because I'm 50 now. I can join and get those discounts. But this is a different organization, Arkansas AAP Foundation update. And years ago, when Missy and I and Eddie were kind of revamping the state chapter and kind of getting more active, we created this foundation to be sort of a nonprofit arm of to the membership organization for lots of reasons. And it was really a great thing. Eddie did a tremendous amount of work on this as far as creating the nonprofit 401c3. But we kind of have trotted along for a while and have not used this as much as we probably could, and we are beginning to look at that. I actually is post immediate past president, whatever my role now as the state chapter, had served as the chair to the foundation. And then really we had set it up that the immediate past president would be chair of the foundation. And so that would be Gary. So when Gary and I talked about this, we sort of wanted to get the foundation, give it some direction. And he has graciously asked me to co-chair with him for another year or two on the foundation board. We've had a really committed board of directors who have long outlived their dates as far as serving within the bylaws, but they have all felt strongly about this. So our treasurer, Patty Weed, and then our secretary, Jennifer Ferguson, and then Missy, Eddie, and I continue to serve to kind of see the foundation forward. And then Heather Mercer, who is with Immunize Arkansas, she has really been a very strongly committed member as everybody else. So that is your current foundation board. I don't know what the next, I did look at the slides the other day, but okay, yeah. So this is what we're kind of currently doing. Currently kind of trying to figure out the direction of the foundation. So we are working on some strategic planning, working with the board, and that will occur this fall and winter. We have used the foundation to receive grants, and that was sort of the goal, was to support as monies that would come into that couldn't come into the chapter because of the membership requirements, but that's sort of maybe changing a little bit. But we have kind of dealt with those two grants. We do have a good solid foundation for the foundation. This is money that's been raised, 83,000 over, and we've been kind of holding on for, I guess, almost 10 years now. But to support member activities, and also one of the goals also was to, if we were in a pandemic situation, that we could support members getting together and socializing and going around the state and having maybe some dinners with people, things that the membership organization could not do. But it did support your Starbucks card that you got in your box. Hopefully everyone received their box from the state chapter. But really, just wanted to support physician and social wellness and activities. So we are looking forward to what we can do with these monies in the future. I mean, it's kind of like vaccines. If the vaccine is not an arm, it can't do anything. So if we can't take this monies and turn it in and support chapter activities or support member activities, then it's really kind of useless. So we're going to move forward. And if you have any ideas about ways that we could use these funds, or we are also looking for new board members. So they kind of have to be non-members, but supportive of, well, they can be members, but they can't be people who receive monies from the foundation, I guess, or have any kind of conflict of interest. But if you have people who you think would be great foundation board members, we would love to hear those nominations. And onwards and upwards. I'll turn it back to Susan.
Chad, if I could just
add
a couple of, I just want to add a couple of other comments. I think what we hope to do with the foundation, and Chad alluded to it, is really take a good look at our administrative structure of the foundation. There have been some other states that have combined their 501c3 and C6 organizations into a single C3 unit. There's some administrative benefits to that. The functions of the board would still be still maintained, but it's a pretty complex process. And so we're going to be exploring that over this year and probably bring some recommendations back to the full membership at the end of this year. The second thing is we do see the foundation, or the functional purpose of the foundation, to have some great value. And there are some ideas that have been thrown out about how we might use funds to, if you will, stimulate the pipeline by using them to engage medical students as well as residents, either through contracts or other incentives, incentives to get engaged in pediatrics and to attract the best and the brightest into the field. And then the other idea that's been proposed is that we use funds from the foundation for some of our new directions in diversity, inclusion, and equity. And that's another example of ways that we might do that. But there's only a fixed amount of money in the foundation right now. So we're also looking at how we can have a sustainable and dynamic way of raising money to maintain the funds that are in the foundation for the purposes that we've outlined. So you'll hear more about that at the end of this year. We hope to go through a strategic planning process to get some answers and recommendations for those questions. Thanks.
Thanks, Gary. It's real quick. So I wouldn't be doing my job on the national level if I didn't include the fact that I'm now your representative to the Committee on Development for the National AP. And when you say Committee on Development, that is not walking, talking, and stacking blocks. It's fundraising for the Friends of Children Fund and other things that help with national AAP priorities. And so if anyone wants to ever talk about the national fundraising, I'm not going to do that here today because our goal is to support the foundation, but would love to engage you guys and appreciate everyone for what they do for children.
Yeah. And just to dovetail on that, Chad's appointment is really a big deal. The fact that he was selected among the many candidates who were proposed for that is really, really important, but it also illustrates how functioning or working on national committees at the AAP level nationally funnels down to benefits to the chapter. So we have, I don't know, at least a half a dozen people and a little bit more maybe that are currently serving on national AAP committees, and their contributions have been highly significant. So thanks, Chad, for sticking around with the board so we can learn about the examples from other states about what's worked and what has not worked in terms of fundraising. So we do the best we can here in Arkansas. All right, Anna, Susan.
Well, thank you both. And I think we're right at 1:30, but I just wanted to mention that I hope that this conference has been giving you guys a glimpse of what AAP membership means and what your AAP membership, both in the state and national level, does for you, and also what you can do, because our organization is only as strong as our members and leadership and the people who put their time and efforts into it. So thank you all for being here on a Friday afternoon and a Saturday morning to get together, network, learn from each other, and make this event a reality. And Anna, do you have any closing remarks?
I just wanted to say thanks to everybody. Thanks to you for your leadership. So grateful for that.